the basis of my earlier motion and earlier proceedings to get a copy of that BCA drive. So when I originally received these training materials, for example, these training materials are 20 to 30,000 pages in PDF format. And you can look at some PDF of a PowerPoint presentation, and it says use of force, academy, whatever the topic is. No frame of reference as to when this was given, who, there's no title, there's no dates, there's no information, who taught this course, who attended this course. And some of that information contains very important statements on the part of the Minneapolis Police Department. When I receive the BCA drive much later, and I look at them in their native formats, the reason I wasn't seeing the titles of these presentations or the dates of these presentations is because that's how they were saved on the drive. So it would say 2018 Phase 1 Defensive Tactics, right? So you know that this is now the training material from 2018 from the Defensive Tactics course, or it will say 2018 Crisis Intervention Training, whatever, 2018 Human Factors of Force Training. So the dates and titles of these courses were given on that drive. Now again, you can look and you can see in his workforce director training or his workforce director program that he got credits for this 8-hour day. But again, which presentations were given on that particular day, you can't, there's literally no way to put this together. And I don't think that the state would disagree with that.
Well, let's see if they do. Mr. Slisher, can you tie a specific training module to the date that Mr. Chauvin actually attended?
Your Honor, what we can do is first show the workforce director training, which memorializes what particular trainings, in-service trainings, the defendant has attended, and the titles of those different trainings.
Okay.
Then what we can do is have the trainer specifically talk about the materials and curriculum that they've developed for those blocks of training, and
for those dates.
On those dates for that. So, for example, if it's going to be the fall in service, there was a PowerPoint presentation that was developed from the curriculum from that fall in service, and they can say that PowerPoint training was in fact presented. And these materials, they get recycled from year to year. There's nothing markedly different, in my view, from one to the other. They cover the same generalized concepts. And so, from a foundational standpoint, I think it's pretty clear that the training, the content, was imparted on, in this particular class, and that the defendant attended that class.
Well, it seems that a necessary foundation, I think you'd agree, would be this is the training provided on this date that the defendant's records show he attended. Even if it's embedded with 8 hours of other training, I think that would make it relevant. If you have training, but you cannot connect it to a training that Mr. Chauvin was at, it's hard to say then that you've laid the foundation for it. But it sounds like you've got the foundation. Am I correct?
Yeah, I think it's pretty clear, Your Honor.
Now, as far as the other issues Mr. Nelson's identified, that seems to be more weight. It goes to weight, and you can cross-examine on it and say, this was a 3-slide PowerPoint in the midst of 8 hours of training on other topics. And that's pure, absolutely fine because it goes to the weight, the evidence, as opposed to its admissibility. All right, Mr. Nelson, one last comment, Mr.
Yeah, I guess, Your Honor, I'm not objecting to the admissibility of this training. The question becomes, I think, and I don't think that it's as easy as as it's presented. It's because even some of the things that they've said that they intended to introduce, that are clearly from the academy, from the police academy, they're not from in-service records, but it contains the information that may have been a part of some other training. That's where so case in point, there's a PowerPoint presentation from the Minneapolis Police Academy about nerve manipulation and basically joint manipulation, nerve endings, and how to gain compliance through pressing or depressing someone's nerves. It's clearly a training material from the police academy from 2017 or 2018. Officer Chauvin was not in the police academy in 2018, but ultimately it's part of their training. Now, where did that come from? You know, when was it presented to him? I don't know, and I don't think it could ever. There is no other record of that type of training. So there are training materials. I think there's two levels. If the Minneapolis Police Department comes in and says, we never train our officers to do X, right, and insert X, but there are training materials that contradict that testimony, that undermine that testimony. I'm not questioning the foundation for these records. These records exist. They all came from the Minneapolis Police Department. But whether or not I need to show that Mr. Chauvin had that specific training, I think is one question.
Well, let me stop you there. It seems like there are two levels here, and perhaps I think the foundation for any of this training material is, at one level, if it's certain training, defendant has been exposed to, he's been part of that training, so he has certain knowledge based on that training, that certainly seems admissible. If it's training that was provided by MPD, but there's no indication Mr. Chauvin took it, or this is not the version that he was trained on, that does not seem relevant at all. The only way I could see training that he had not attended, which might be relevant, is to impeach, for example, and I don't know if this is true or not. I just note that Lieutenant Zimmerman said in his 40 years, roughly, on the Minneapolis Police Department, he had use of force training every year. He was never trained to do X. And if you have use of force training that impeaches that statement, I think that's appropriate impeachment. But aside from that, I don't see why testimony that the defendant has not been a part of should be admissible at all.
And that was kind of the concern that I had and had raised in terms of why I thought it was important that each side identify those training materials that needed to be or were intended to be introduced. Because, again, I agree with the court's analysis. It's an impeachment question on one hand. If as you know, Lieutenant Zimmerman says we were never trained to put our knees on the neck, but there's a Minneapolis Police Department policy that says otherwise, and there's ample training materials that would contradict that statement. That's impeachment of testimony, and certainly should be admissible for those purposes. Now,
yeah, had he not said that, for example, I don't think it would be admissible, because again, this is training that the defendant didn't have, and unless you can show he had that training, it's not admissible from either side.
And I think that goes to sort of some of the problems why I raised you can't have every single officer come in and say this was or wasn't a reasonable use of force, because the training he had may be different than the training that Zimmerman had.
Right. And so we've got so far opinions from Sergeant Pluger and from Lieutenant Zimmerman on use of force. We're going to hear from the commander or the then commander of the training unit about it. Beyond that, I think we have an expert witness from the state and an expert witness from the defense. Is that correct?
Two expert witnesses from the state on use of force here.
All right. We are getting to the point of being cumulative. We're not asking every officer because that's cumulative. But also, even having two seems like it might be cumulative, but I'll deal with that later. It just seems like we said early on in the motions in limine, you're not going to be able to ask every officer, what would you have done differently? And we're not going to go through that. I've given you pretty good leeway that the sergeant who was involved in the case and the lieutenant who was involved in the case, a lieutenant who's been a peace officer for roughly 40 years, gave his opinion. Now you're going to have the training unit and the two experts. That's it. We're done with it, with asking other officers about the use of force. And Sergeant Yang, you can ask about what the training is on crisis intervention if the defendant had that training.
And so this is where, again, I don't know if the state is intending to call any So Inspector Blackwell, she's the kind of the top dog in the training unit, but then there are the actual use of force instructors, right? It's the people who teach these trainings, and at least 2 of whom have been repeatedly interviewed by the state. I don't know if they're intending to call the actual trainers as well, which just puts, like, you know, if Commander Blackwell, she's not teaching, as far as I can tell, these classes. She's not the one administering them, but she's maintaining the records, she's maintaining the training. She's a foundational witness to get these records in. I would have expected the state to introduce the actual training people, but maybe that's not what they intend to do.
Is the state intending on asking Inspector Blackwell for an opinion regarding the use of force in this case?
No, Your Honor. The state is going to be calling Inspector Blackwell to describe the training facility, the curriculum, how it's developed, how it's set up, how it's administered. She will offer the opinion, or I guess it's not an opinion, it's a fact, that MPD does not train its officers to place a knee on a subject's neck and restrain them in that position for as long as happened. She'll do that, but mainly go through the records and describe the curriculum and the facility and the trainers, how it's staffed, and then the individual trainers will impart the knowledge from the various disciplines. We have, you know, Carrie Yang, who we mentioned, on crisis intervention and procedural justice training. We have the use of force trainer, probably Johnny Mersel. I don't know that I need to have both Mersel and Schoonover testify on the defensive tactics side of it. And then the medical training that the officers receive from Officer McKenzie. And those are our trainers. And then we'll go into more of a practitioner level expert, Jody Steger. And then at some later time, the academic expert will testify, but not immediately.
Yeah, my main concern, obviously, the medical training they received. So again, what did Mr. Chauvin know? What it was his training? What was his experience up to that date? All relevant. When we start getting into the opinions, how many use of force opinions do we have? It's cumulative, I think, possibly already. But I think as you go through each of those, it's got to be talking about training that the defendant received. Not just, here's trainings we had. Because if he didn't take the training, it doesn't go to his intent or knowledge.
Understood, Your Honor. The workforce records specify what, you know,
right,
in-service training the defendant has attended, and then we have the curriculum, the materials that were presented, you know, during those training blocks.
And crisis intervention training seems to be relevant to this case. Use of force training is relevant to this case. Medical training is relevant to this case. So all those summaries of the training that the defendant received, according to his records and what the curriculum is, that's, I think, all admissible. I think when we start getting into opinions about use of force, I think we should visit about that before we start blurting out opinions. We've already had several, and I think we need to go tread carefully because of whether their opinion is something that is the appropriate topic even for expert testimony, because some of this stuff is within the jury's knowledge and they should be able to do without an expert. So, but I think let's just kind of go with that for now.
If I may, just as to the cumulative discussion, just to add to that, foreseeing Mr. Nelson being an able defense attorney, I would anticipate if I were to just simply try to prove my case with experts, he would say, the state hired some experts to say this was unreasonable, but what do the people who actually do the work say?
Well,
right?
and I think we've gotten 2 of those already.
And that's the reason. I'm just, I need to cover the appropriateness of the use of force really from every angle to give the full picture of the reasonable officer. I understand at some point enough is enough.
Well, let me be a little more clear. I think you have the right to somebody who's actually done the defensive tactics, use of force training, whatever, to give their opinion about this case. But not everybody, not every trainer, You can take one who's done the training, knows the curriculum that Mr. Chauvin actually participated in, and say and give an opinion there. But I think then we're done with the MPD people who can give an opinion regarding defensive tactics and use of force. So, does that make a little more sense?
It does, Your Honor. I think that was my plan.
Okay, good. Always good to have a plan that's consistent with the court's rulings.
And I guess the court will let me know if you feel I'm
Yeah, let's just go sidebar if we have to in the
Yes.
midst of all this, because as we know, everything is fluid. So, all right, we'll get the jury. All right, Mr. Blackwell.
Good morning, Your Honor,
Go ahead.
Counsel, ladies and gentlemen. The state calls Dr. Bradford Langenfeld, John.
Give me stand right behind the chair. Raise your right hand. You swear or affirm on the penalty of perjury that the testimony you're about to give will be the truth and nothing but the truth. Thank you. Have a seat, please. And before you begin, a couple things. If you feel comfortable taking the mask off, we'd prefer that you do that, but
Sure.
as a doctor, I can tell you I've had both my shots. That helps. But we'd like you to state your full name, spelling each of your name.
Sure. So Dr. Bradford Wankede Langenfeld, Bradford, Wankedlangenfeld.
Mr. Blackwell.
And we can just call you Dr. Langenfeld.
That's fine.
Dr. Langenfeld, did you provide emergency care to the body, to George Floyd, after he was taken to Hennepin County on the evening of May 25th?
I did.
Just by way of introduction, are you the physician who officially pronounced him dead that night?
That is correct, yes.
Were you one of the physicians who tried to save his life?
Sustained.
Did you administer care to George Floyd on May 25th, 2020?
Yes.
What were you trying to do?
We were trying to resuscitate Mr. Floyd.
To save his life.
Correct.
So why don't we learn a little bit about your background, Dr. Langenfeld. Where are you currently employed?
Currently, I'm working at Grand Itasca Clinic and Hospital. It's up in Grand Rapids, Minnesota. It's my primary practice. And I also work in Waconia, Minnesota at Ridgeview Medical Center.
And Waconia is in Carver County here?
That's correct.
Grand Rapids is several hours driving away from here.
That's correct.
Why Grand Rapids?
I was born there. It's my hometown.
It's also the hometown of Judy Garland, isn't it?
It is, yes.
Are you licensed in emergency medicine?
I have a Minnesota State medical license and I practice emergency medicine.
Would you tell the ladies and gentlemen of the jury what is emergency medicine as a practice for a doctor?
It's a very broad practice, but primarily involves taking care of patients suffering from critical ailments. Oh, sure. Critical ailments such as strokes, heart attacks, car accidents, other emergencies such as that, but also less emergent conditions, sore throats, urinary tract infections, things like that.
When were you first licensed?
May of 2020.
Would you tell the ladies and gentlemen of the jury a little bit about your educational background?
So I attended medical school at the University of Minnesota Twin Cities and then residency training at Hennepin County Medical Center.
And when did you finish your residency then?
Last summer.
Have you ever had any occasion to testify in a court before?
No, I have not.
This is the first time.
That's correct.
Let's go to Monday, May 25th, 2020, last year, Memorial Day. Do you recall whether you were working that evening?
I was, yes.
Where were you?
I was in the emergency department.
At the Hennepin County Medical Center?
That's correct.
And what was your position or title there?
I was one of the senior residents. We're involved with direct patient care, including both critical care and overseeing some of the junior residents.
Do you recall what time your shift began and ended?
It began at about 1 p.m. that day and ended at approximately 11 p.m.
And as a senior resident, what was your role?
My role was primarily direct patient care. I work underneath attending physicians as a resident.
Did you also oversee any other residents?
Yes.
Which residents would you have overseen?
More junior residents earlier in their residency training.
Now, in terms of was care administered to George Floyd on May 25th by yourself?
Yes.
Yeah. Who was the person primarily responsible then for George Floyd's care in the Hennepin County Medical Center Emergency Department?
I provided the majority of direct patient care under supervision of Dr. Ashley Strobel, who was my attending physician at the time.
Were you the primary decision maker?
I was.
Were you the person responsible for much of the direct patient care?
Yes.
When Mr. Floyd's when Mr. Floyd was brought in, would you describe it as an emergency situation?
Yes, absolutely.
What was his condition in terms of his cardiac condition?
He was in cardiac arrest.
And does cardiac arrest mean that he had had a heart attack, or what does that mean?
Not necessarily.
What does cardiac arrest technically mean?
Cardiac arrest is defined as sudden cessation of blood flow to all the tissues of the body when the heart stops pumping, typically as evidenced by absence of a carotid pulse.
So in lay people's terms, if we were to say cardiac arrest means the heart stopped, would that be accurate?
Yes.
What was your immediate objective when Mr. Floyd comes in and he's in cardiac arrest? What were you immediately trying to do?
Find a way to get the heart to pump on its own again. The primary goal in cases such as this is to achieve ROSC, which means return of spontaneous circulation. And part of that process involves trying to identify the cause of the arrest to see if there's any reversible causes, and continuing CPR and other life-saving measures.
And time is of the essence?
Yes.
How did you first learn that Mr. Floyd was being transported to the emergency department at Hennepin County Medical Center?
I received we call it a zip-it page. It's basically a EMS notification.
Now, first tell us what EMS is.
Emergency medical services.
And a zip-it, is it essentially a text-type message, or how would you describe a zip-it?
It's sort of like a encrypted text.
What time did the zip-it come in?
I don't recall exactly. Maybe around 8:50 p.m.
What information was provided to you for his care and treatment by zip-it?
The information was that it was a 30-year-old unidentified male who was in cardiac arrest, and that's as much as I can recall at this time, yeah.
Do you recall whether any information was given to you as to what may have happened to him ahead of time, before he got there, to explain the cardiac arrest?
Not at the time, not before he got there.
Did you know at the time he arrived that the patient was in fact George Floyd?
I did not.
So you learned that at some point later, that it was George Floyd?
Yes.
Did you also know at the time that there was a video or any videos that depicted what had happened to Mr. Floyd before he was transported to the Hennepin County Medical Center on May 25th?
No.
Grounds? Overruled.
You can answer. Were you aware of the existence of any videos as to what may have happened before he arrived at Hennepin County Medical Center on May 25th?
No.
Did you subsequently learn about videos?
Yes.
Were you able to evaluate your assessments about George Floyd in light of the videos?
Yes.
We'll talk about those a little bit later. So when you received this zip-it, what did you do in response to it?
We prepared a bay in our stabilization room, which is essentially a large room with a lot of critical care resources. We sort of prepped a team and got ready to take care of the patient when he arrived.
Do you recall roughly what time Mr. Floyd would have arrived in the emergency room?
Approximately 8:55 p.m.
And when he arrived, then had CPR been started?
Yes.
Any mechanical devices or other things being used to help to stabilizer?
Yes, there was a Lucas CPR device, which is basically a mechanical device that sits across the body with something that almost looks like a plunger and pushes against the chest to provide CPR or chest compressions.
So this Lucas device then was on Mr. Floyd when he arrived in at the hospital.
Correct.
Did you ever observe at any point in time that his heart was beating on its own?
Not to a degree sufficient to sustain life.
Do you recall who brought Mr. Floyd into the emergency department?
I do recall 2 paramedics and possibly 1 or 2 other people, but I don't remember exactly.
Do you recall whether there were any police officers there also?
I don't personally recall that, no.
Did the paramedics who arrived at the emergency department give you a report?
They did.
Do you recall what they said for purposes of treating Mr. Floyd?
I do. The report they gave us is that they were called to a scene of someone who was suffering from a medical emergency. As I recall, and this is what I was told at the time, they were initially called for a lower type of acuity event of facial trauma, and then that was upgraded to an individual in distress. They reported that on their arrival, the individual did not have a pulse, and CPR was started. They placed an eye gel, which is a supraglottic airway device. It's basically
A super what?
supraglottic airway device. It's just a sort of a tube that goes down into the throat and can ventilate the lungs. And then they gave medications, including epinephrine and sodium bicarbonate, to try to resuscitate Mr. Floyd as CPR was ongoing.
Did they tell you that Mr. Floyd was in police custody?
They did mention that he was being detained at the time.
Now, did you recognize either one of the paramedics who came in?
I did. I did recognize both of them, and I worked with one of them several times before.
Derek Smith, did you know a Derek Smith?
I believe so, yes.
And do you recall having worked with a Derek Smith before?
I do.
How often?
Several times throughout the course of my training.
When the paramedics bring a patient in to the emergency department, is it standard protocol for them to tell you why they are bringing the patient in? What's the emergency?
Yes.
In what the paramedics told you when they brought in Mr. Floyd, did they also then give you information when they brought Mr. Floyd in?
They did. They essentially gave the report that I just told you, yes.
Did they say to you, for purposes of caring or giving treatment to Mr. Floyd, that they felt he had suffered a drug overdose?
Not in the information they gave, no.
Did they tell you in the information they gave that they felt that Mr. Floyd had had a heart attack?
No.
Did you receive any information or indication from the paramedics when they brought Mr. Floyd in that anyone had attempted CPR on Mr. Floyd at the scene on May 25th, 2020?
Overruled.
I did not receive a report that Mr. Floyd had received bystander CPR, no.
Did you receive a report that he had received CPR from any of the officers who may have been on the scene on May 25th, 2020?
No.
Is the administration of CPR right away important for you to know when you're dealing with a patient who has suffered cardiac arrest. It's important for you to know about that.
It is in the sense that it informs the likelihood of survival.
And what do you mean by that, Dr. Langenfeld?
It's well known that any amount of time that a patient spends in cardiac arrest without immediate CPR markedly decreases the chance of a good outcome. Approximately 10 to 15% decrease in survival for every minute that CPR is not administered.
Did the paramedics then tell you anything about the care that they had administered to Mr. Floyd?
Yes.
Can you tell us what they told you?
That they had started CPR and placed that airway device and started bagging the patient, as in providing breaths, and then administering those drugs. Yes.
And so when you talk about bagging the patient, could you describe what that is?
Yeah, it's called a BVM, or a bag valve mask. It's essentially a device that's hooked up to oxygen on flow to simulate giving a breath, or mouth-to-mouth, as it might be more better understood. But yeah.
Did the paramedics start something that's referred to as the ACLS algorithm?
Yes.
Would you tell the ladies and gentlemen of the jury, what is the ACLS algorithm?
So ACLS stands for Advanced Cardiac Life Support. It's basically a standardized way of taking care of patients in cardiac arrest.
And so these are protocols, or sort of a checklist process you go through when somebody shows up in cardiac arrest.
Correct. It's a little broader than that, but a big part of it is for folks in cardiac arrest, yes.
Is it to help you to determine why the person might be in cardiac arrest so you know how to treat them?
Yes.
Have the paramedics tried to resuscitate Mr. Floyd?
Yes.
Do you recall how long?
The report we received was for approximately 30 minutes.
Now, you had mentioned to us just a moment ago that they had administered epinephrine and sodium bicarbonate. Would you tell the ladies and gentlemen of the jury, what are those administered for?
Epinephrine is colloquially known as adrenaline. It's a drug that has been studied extensively and is part of the standard protocol for ACLS. The evidence on it is somewhat controversial, but it is part of the standard protocol. Sodium bicarbonate is a medication that may provide some buffering of the acidic environment in the blood that occurs during cardiac arrest, and that is perhaps a more controversial medication than epinephrine.
Did the paramedics tell you whether they had checked Mr. Floyd's heart function?
Yes.
Well, let me ask that a different way. I want to talk to you about two different kind of heart functions and see if you can describe what they are to the jury and how or if they relate to Mr. Floyd. The first one we refer to as PEA. Do you know what PEA refers to?
Yes. So PEA refers to pulseless electrical activity. It's basically a situation where someone is in cardiac arrest. They do not have a pulse, as we previously discussed, and they do have some electrical activity on the monitor. And that suggests certain underlying causes that are known to be more common. The most common cause of someone being in PEA arrest, the most common causes are hypovolemia, either from typically bleeding or from hypoxia or low oxygen.
So we'll talk about those in more detail. But was Mr. Floyd in PEA status, pulseless electrical activity, when you saw him on May 25th?
He was, yes.
And there is another term I'd like to talk about and have you explain to the jury, asystole, I think it's called. Am I pronouncing that right, by the way?
Asystole, yeah.
Yes. Would you spell that for ladies and gentlemen of the jury?
Asystole.
And what is that, Dr. Langenfeld?
It's probably best known as flatlining, where there's no cardiac activity on the cardiac monitor and the patient is in cardiac arrest.
And so was Mr. Floyd in asystole status also when his body was brought into Hennepin County Emergency Department on May 25th?
At some point, yes, there was report that at some point he was felt to be in asystole prior to arrival.
And was he, and asystole meaning flatline, was there any point in time during your treatment of care on May 25th that Mr. Floyd was anything other than flatlined during your care and treatment of him?
There were times, for the majority of his time in our emergency department, he was in PEA arrest. Ultimately, that did devolve into asystole.
Is pulseless electrical activity, PEA arrest, asystole, are those conditions of the heart where you can simply apply a shock and potentially bring the patient back?
No.
What are what we refer to as shockable rhythms? Is there such a thing as a shockable rhythm?
So typically these are thought of as either ventricular tachycardia or ventricular fibrillation, which are basically abnormal rhythms of the heart that are more commonly associated with cardiac arrest, specifically from a heart attack. And they are rhythms that you can administer electricity to and shock a patient back into a normal rhythm.
But Mr. Floyd didn't have ventricular fibrillation or ventricular tachycardia.
Correct.
Because his heart wasn't pumping.
Yes, because he did, yes. In both situations, it's a little more complicated than that, but yes, he was not in VFib or VT, as we commonly call them.
Do you recall, were there still handcuffs on Mr. Floyd when he was brought into the emergency department?
I don't specifically recall if they were on when he immediately arrived, but it would be unlikely because he had the Lucas CPR device on, and I recall his hands being at his sides.
Do you recall with his hands at his sides whether there were any indentations or marks on his wrist?
At the end of the case, yes, after he was declared dead.
What did you observe in that regard?
I'm sorry, can you repeat?
In terms of any indentations on his wrist or markings on his wrist?
I inferred that it was from handcuffs.
So let's talk about then the care you then provided once the paramedics have brought Mr. Floyd to the emergency department. What did you do?
So immediately on arrival, we took report from the paramedics. Mr. Floyd, as we knew him at the time only as an unidentified individual, was transferred over to the bed in the emergency department. As I recall, multiple things typically will happen simultaneously in these cases, but we achieved additional access. I placed intraosseous line in his bone in his leg.
Would you tell the ladies and gentlemen of the jury what interosseous
It's
means?
basically a type of IV that goes in through the bone and injects fluid or medications directly into the bone marrow, essentially. It's a type of access that's easier to achieve in someone who's in cardiac arrest.
And did you also go through the advanced cardiac life support protocols?
Yes, so simultaneous to that and obtaining blood draw and continuing chest compressions, etc. It went through various different things that could be causing this. Commonly in the ACLS protocol, these are thought of as the H's and T's specifically with regard to the PEAA systole algorithm.
Well, let's, if we could, take a look at the H's and the T's.
Sure.
So, Brett, if you could pull up, I think, 900. I'm showing you what's marked as Exhibit 900 for illustrative purposes.
Sidebar?
Dr. Langenfeld, going back to Exhibit 900, on the H's and the T's, which were part of the protocols for advanced cardiac life support. Could you briefly explain to the jurors what the H's and T's are?
So these are common reversible causes of cardiac arrest in individuals, typically in PEA or asystole cardiac arrest. A lot of these etiologies are perhaps best evaluated through an ultrasound-based approach, but I can go through all of these. So hypovolemia, typically hemorrhage or bleeding. So we would think of that more in a traumatic cardiac arrest. Hypoxia, low oxygen. Again, those being the two most common causes of PEA asystole arrest. Hydrogen ions, acidosis can be from any number of causes, but essentially where the pH in the blood gets so low that the heart cannot function. Hyperkalemia is low or high potassium, it being a very important electrolyte for proper cardiac function, and disturbances on the extreme can lead to cardiac arrest. Hypothermia, very cold. Toxins, there's a lot of different toxins that can cause cardiac arrest.
And that's from poisons to potentially drugs.
Correct. Tamponade specifically refers to fluid around the heart that can prevent the heart from filling and then lead to the heart stopping. Tension pneumothorax is air around the lung, between the lung and the chest wall, that essentially expands to the point where it prevents blood flow from returning to the heart, and therefore leading to cardiac arrest. Cardiac thrombosis specifically can refer to a heart attack or a ruptured plaque in one of the coronary arteries of the heart. And then pulmonary thrombosis or pulmonary embolism is a blood clot in the pulmonary arteries that prevents blood from flowing from one side to the other of the heart, and therefore leading to the heart no longer functioning.
You mentioned ultrasound. What is the role of ultrasound in studying or trying to assess the cause of cardiac arrest?
Ultrasound can be used to evaluate many of these different causes. I think people would be most familiar with ultrasound from movies where they look at the baby using an ultrasound device or a small probe on the abdomen, but it's the same technology. So we can look at the heart directly and see if there's fluid around the heart, for example. We can evaluate for a large right ventricle that might be suggestive of a pulmonary thrombosis due to increased strain on that side of the heart. We can look for evidence of hemorrhage, hypovolemia, by looking in the abdomen to see if there's any bleeding or bleeding elsewhere. We can look for evidence of tension pneumothorax. For example, we can evaluate for what's called sliding signs on both sides of the chest that would suggest that the lungs are up and there's no air between the lung and the chest wall. So we can use it to...
That the lungs are properly inflated then.
Exactly, yep. So we can use it to evaluate for a large number of these etiologies.
So you went through the protocols of the H's and the T's. Did you have any kind of leading theories for treatment purposes as to what the most likely causes were for Mr. Floyd's cardiac arrest?
I felt that I was able to determine that some etiologies or causes were less likely based on the information that I had both from the paramedics and also the information I was able to obtain from my exam and ultrasound, etc. At the time, based on all the information I had, I thought it was less likely that the patient had suffered from, for example, cardiac tamponade. There was no fluid around the heart, tension pneumothorax, we can discuss that briefly. At one point in the case, I was concerned that he may have developed a tension pneumothorax, but I felt it was unlikely. We did, in fact, perform bilateral finger thoracostomies where we entered the chest.
Let's ask another question.
I'll ask another question. You were explaining to the jury that you thought it was not likely a cardiac tamponade. Then you're explaining why you thought that tension pneumothorax was not likely.
Correct.
And could you, in plain English, help the jurors to understand how you might have eliminated that?
We essentially used a scalpel to cut into the chest and create a hole between the chest and the potential space around the lungs. We did not appreciate any large gush of air that might suggest that there was air in that potential space.
Was there anything that you looked at to determine whether or not the cardiac arrest was likely or unlikely to be related to Mr. Floyd having had a heart attack?
A lot of that is based on the history that we received from paramedics. There was no report that, for example, the patient complained of chest pain or was clutching his chest at any point or having any other symptoms to suggest a heart attack. That information was absent. Also, the fact that he was in PEAA systole, as I was told on the initial rhythm check, further decreases the likelihood of that possibility. At the time, it was not completely possible to rule that out, but I felt that it was less likely based on the information that was available to us.
Did the ultrasound play any role in the question of whether or not he did or did not, or was likely not to have had a heart attack?
No, not especially in this case, no. Did not.
Did you consider the possibility of toxins, for example, being responsible for Mr. Floyd's cardiac arrest, including potentially drugs?
In the sense that it might have informed our care, yes. I didn't, there was, again, no report that this patient had, for example, overdosed on a specific medication, such as calcium channel blocker or any other medication for which there might be a very specific antidote. And so in that sense, I didn't feel that there was a specific toxin that we could give a medication for that would readily reverse his arrest.
And what about then hypoxia?
So hypoxia being, again, one of the most common causes of PEAA systole just in general, I did then, as I'd mentioned, use the ultrasound to look in the abdomen and did not see any evidence of hemorrhage. There was no obvious significant external trauma that would have suggested that he suffered anything that could produce bleeding sufficient to lead to a cardiac arrest. And so, based on the history that was available to me, I felt that hypoxia was one of the more likely possibilities.
And hypoxia as an explanation for his cardiac arrest, meaning oxygen insufficiency.
Correct.
Did you have any other leading theories as to why Mr. Floyd's heart may have stopped other than oxygen deficiency?
Yes. I also considered an acidosis. In particular, excited delirium, which is a controversial diagnosis, but it was in the differential in this case.
And were you able to make any assessments about so-called excited delirium based on your examination of Mr. Floyd?
Again, the patient had been in cardiac arrest for 30 minutes. It can be difficult based on the examination. Certainly there was no report that the patient was ever very sweaty, which is often the case when thinking about excited delirium. There was no report that the patient had ever been, that Mr. Floyd had ever been extremely agitated. In my experience, seeing a lot of cases of mental health crises or drug use leading to severe agitated states, that is almost always reported by paramedics. And so the absence of that information was telling, and that I didn't have any reason to believe that that was the case here.
So how long was Mr. Floyd in your care in the emergency department?
Approximately 30 minutes.
And at the end of the 30 minutes, did you pronounce him formally dead?
Yes.
At the time you pronounced him dead, was he still in some degree in PEA or asystole in terms of describing his heart?
I think it's probably best to think of these as sort of a spectrum where PEA is some degree of electrical activity still running through the heart, but the heart's not pumping. And then eventually that will devolve into asystole, where both the heart is not pumping and then the electrical activity stops as well. And so at the end of the case, Mr. Floyd was still in PEA, but there was virtually no cardiac activity. And at that point, in the absence of any apparent reversible cause, and because Mr. Floyd had been in arrest for, by this time, 60 minutes, I determined that the likelihood of any meaningful outcome was far below 1%, and that we would not be able to resuscitate Mr. Floyd. And so I then pronounced him dead.
And doctor, was your leading theory then for the cause of Mr. Floyd's cardiac arrest oxygen deficiency?
That was one of the more likely possibilities. I felt that at the time, based on the information I had, it was more likely than the other possibilities.
And doctor, is there another name for death by oxygen deficiency?
Asphyxia is a commonly understood term.
Thank you, Dr. Langenfeld. No further questions.
Mr. Nelson. Yep. It's 9 o'clock, so we're going to take our 20-minute mid-morning break. Thank you. get our doctor back?
We do, Your Honor.
Hey, Mr. Blackwell, I forgot to plug in my headset, so it's a Monday. And just a reminder, Doctor, you are still under oath. Mr. Nelson.
Good morning, Doctor.
Good morning.
Thank you for being here today. I have a few follow-up questions for you, kind of picking up right where we left off. You were discussing hypoxia kind of being consistent with asphyxiation, right?
Correct.
Hypoxia is the lack of oxygen to the brain, correct?
Correct.
And there are many things that cause hypoxia that would still be considered asphyxiation. Agreed?
Correct.
Drug use. Certain drugs can cause hypoxia. Agreed?
Yes.
Specifically fentanyl.
That's correct.
How about methamphetamine?
It can.
Combination of the two?
Yes.
All right. Now, you testified about certain things that happened during your care of Mr. Floyd. You were running all sorts of different tests. You used the
Ultrasound.
Ultrasound.
Yep.
Thank you. Used the ultrasound. You took some blood samples as well,
Correct.
and you took some blood gas samples as well. Correct?
Correct. From the blood samples. Yes.
So, can you explain what the blood gas samples are?
So the blood gas samples are analyzing different parts of the blood, specifically looking at the pH or how acidic or basic the blood is, looking at the amount of oxygen in the blood, the amount of carbon dioxide, the amount of bicarbonate.
Okay. And carbon dioxide levels in this case were pretty high, weren't they?
Correct.
Do you recall what the carbon dioxide level was in the blood gas sample you initially took?
I believe the initial blood gas sample I took was a venous blood gas sample, which is less preferable as opposed to an arterial blood gas sample. At the time, I believed it was a venous sample, and I believe the CO2 level in that sample was around 100.
Okay. A little over 100, perhaps?
Yeah.
And that indicates an exceptionally high carbon dioxide level. Agreed?
That, yes.
What would the average, for a healthy person, and you did a blood gas sample, what would you expect the CO2 or carbon dioxide level to be?
For a healthy individual without any sort of lung disease, you would expect somewhere between 35 and 45.
Okay. And so Mr. Floyd's carbon dioxide level was more than 2 times what you would normally expect.
Correct.
Now, the reason that you're doing these blood gas samples is in part to help you analyze and figure out courses of care. Agreed?
Yes.
And that's the carbon dioxide number that we're talking about is essentially, that would be indicative of a person who is not eliminating the carbon dioxide, right? For it to go that way?
Correct. For it to be high in the blood, that means that they are therefore not eliminating it through ventilation or breathing.
And that points to a possible respiratory problem, right?
It can, yes.
And that increase in a carbon dioxide from a 35 to 45 to over 100, that takes some period of time in order to climb that high.
Yes, it can happen relatively quickly depending on how severe the ventilation problem is, but
it generally could take 30, 40, even an hour to climb that high.
it could take that long. It could take much less time, yes.
The use of fentanyl, do you know that to attribute to high carbon dioxide levels?
It can cause high carbon dioxide levels because it depresses the ventilation or the breathing.
So when someone ingests fentanyl, it can cause them to feel very sleepy because of an increased carbon dioxide level. Agreed?
Correct.
And that's one of the reasons ultimately that fentanyl is so dangerous, because it suppresses the respiratory system. Agreed?
The primary reason it is so dangerous. Yeah.
Now, you testified that when the paramedics gave their report to you, they did not give you any reference as to potential drug use, correct?
Correct.
They did not tell you that they had administered Narcan or naloxone during their care, correct?
Correct.
And during the course of your care of Mr. Floyd, you did not administer Narcan or naloxone, did you?
No.
And when you talk about those drugs that are immediately able to reverse the effects, that's what that does. Narcan reverses the effects of fentanyl toxicity. Agreed?
Correct.
When someone has a high carbon dioxide level, that causes that person to have a sensation of shortness of breath. Agreed?
Yes.
And that can happen to a person even without stress complicating their body, right? That respiratory, that feeling of an inability to breathe.
Yes.
Are you familiar with the impact of taking certain narcotics interrectally? Rectally?
Yes.
And that ultimately can provide a more powerful or rapid onset of an impact, right?
Yes.
Simply because a person has a history of chronic opiate abuse, does that mean that fentanyl can't kill them?
No.
When someone is hyperventilating, anxious and hyperventilating, they're actually decreasing their CO2 by doing that, correct?
Correct.
Some of the considerations that you have to take also would be the potential occlusion of a coronary artery, right?
Yes. In cases of cardiac arrest, yes.
And someone who has greater than a 75% occlusion of the right coronary artery, that poses a particular risk of fatal ventricular cardiac arrhythmia, does it not?
Objection, Your Honor. We approach.
Favor? All right, last question's withdrawn. Ask a new question.
Only a physician can declare a person dead, correct?
Depends where you're practicing.
In the state of Minnesota?
Yes.
A paramedic can't declare a person dead.
No, not without consultation with a physician.
So just to, based on your treatment, again, of Mr. Floyd, based on these tests that you did, had an elevated CO2 level, correct?
Yes.
And that CO2 level was considered to be exceptionally high, correct?
Correct.
And you did not, in the course of your consideration, provide naloxone or Narcan?
No.
Okay. And it would be, is it fair to say that the administration of Narcan, if you do not have opiates in your system, is a safe procedure?
Yes.
And if you do have opiates in your system, the administration of Narcan could be life-changing, life-saving.
Yes. Not in this case.
Prior to the, but again, the paramedics also, based on your information, did not administer Narcan.
Correct. Can I make a clarification?
I'm good. No,
No.
There's no question.
If they wish.
I'm sorry?
You said the state can clarify the
Direct if they wish.
And you would agree that Mr. Floyd arrived at HCMC at approximately 8:53, if we have seen evidence previously?
That sounds correct. Yep.
I have no further questions, Your Honor.
Okay, Mr. Blackwell.
Thank you, Your Honor. For starters, Dr. Langenfeld, there was an answer you wanted to clarify. Please do so.
Only to state that Narcan, administering Narcan to someone who potentially suffered a fentanyl overdose, once that individual is in cardiac arrest, the administration of Narcan would provide no benefit.
And Mr. Floyd was obviously in cardiac arrest.
Correct.
You were asked questions just now about whether fentanyl works by causing someone to feel very sleepy. Remember that discussion?
Yes.
Did the paramedics tell you that Mr. Floyd was ever asleep or sleepy or anything that sounds like sleep?
The report that I received was that the patient, Mr. Floyd, was unresponsive on their arrival and did not have a pulse. And so there was no report that he had been sleepy or difficult to arouse per se.
You asked quite a number of questions about the carbon dioxide content in the blood gases. First off, if a person is suffering from hypoxia, that is oxygen deficiency, is that an explanation for a heightened carbon dioxide content in the blood?
It can be in severe cases.
In this case, do you find that the carbon dioxide reading for Mr. Floyd is really all that significant?
I felt that it was weak evidence in support of what I was thinking at the time. What's difficult in cases of cardiac arrest is once someone has been in cardiac arrest for an extended period of time, essentially the blood gas that I obtained could be consistent with cardiac arrest from any number of causes. You expect the pH to be low. During cardiac, I'll provide a little bit of explanation on that. During cardiac arrest, there's no blood flow to the tissues, therefore there's no oxygen getting to the tissues. Therefore, the cells will die they'll release hydrogen ions, which lower the pH, creating an acidic environment. They'll release lactate, which complicates that further. Because the person's heart has stopped from whatever cause, they'll no longer be breathing either. And so you would expect that their CO2 to be high. Again, it can vary a little bit depending on the cause, but in my estimation, the blood gas in this case wasn't very strong evidence for one cause over another as far as the etiology of the arrest.
And it was simply consistent with the fact of cardiac arrest.
Correct.
The fact that the heart had stopped.
Correct. And I felt that the high CO2 may have suggested a respiratory cause.
Now, you were asked questions about somebody administering narcotics interrectally. Remember those questions?
Yes.
Did you get any indication that Mr. Floyd had administered narcotics interrectally?
I had no information to suggest that.
Dr. Langenfeld, thank you.
Anything further? Thank you, Doctor. You may step down. Mr. Slisher.
Thank you, Your Honor. Your Honor, the state calls Chief Madeira Arredondo.
Do you swear or affirm under penalty of perjury that the testimony you're about to give will be the truth and nothing but the truth?
I do, sir.
Have a seat. And before you begin, if you could give us your full name, spelling each of your names.
Yes, Your Honor. Madeira Arredondo. First name is spelled M-E-D-A-R-I-A. Last name is A-R-R-A-D-O-N-D-O.
Mr. Slisher.
Thank you, Your Honor. Sir, what is your current role?
My current role is Chief of the Minneapolis Police Department
How long have you held that position?
for approximately 3 years.
And as Chief of the Minneapolis Police Department, are you responsible for overseeing the operations of the entire Minneapolis Police Department?
Yes, I am.
And that's the highest ranking role at the Minneapolis Police Department, is that correct?
That is correct.
Now, sir, I'd like you to first share a little bit about yourself with us. How old are you?
54 years old.
In what city do you live?
Twin Cities.
Where are you from originally?
Minneapolis.
Where did you go to high school?
The Minneapolis Roosevelt High School.
All right. And have you ever lived outside of the Twin Cities, Minneapolis area?
I went away for college for a couple of years in Michigan. Yes.
Where in Michigan did you go?
It was Hancock, Michigan,
Which school?
which is now called Finlandia University. I'm sorry, Your Honor, Finlandia University.
And what is the highest level of education you've attained?
I received my master's degree.
What degree did you receive in Hancock, Michigan?
That degree was a criminal justice degree.
After you completed your college studies, you returned to the Twin Cities area?
That is correct.
And is that when you first joined the Minneapolis Police Department?
Prior to that, I had worked as a community service officer at the Minneapolis-St. Paul Airport Police Department.
What years did you do that?
I believe that was from 1987 to 1989.
And then in 1989, did you join the Minneapolis Police Department?
I did.
In what capacity?
I started my career as a Minneapolis police cadet and then was hired as a Minneapolis police officer that year.
And Chief, why did you decide to become a police officer?
I've been very fortunate to come from a city of very resilient, very welcoming, proud people here in the city of Minneapolis. And my dear parents taught all of my siblings and me about the service of love. And so I've been very fortunate to then eventually join the Minneapolis Police Department and give back to the very community, the very city that embraced me and has been so good to me.
You familiar with the motto of the Minneapolis Police Department?
Yes, I am.
What is it?
And that is to protect with courage and to serve with compassion.
And what does that motto mean?
We are oftentimes the first face of government that our communities will see. And we will oftentimes meet them at their worst moments. And so the badge that I wear and that members of the Minneapolis Police Department wear, it means a lot because the first time that we interact with our community members may be the only time that they have an interaction. And so that has to count for something. And so it's very important for us to make sure that we're meeting our community in that space, treating them with dignity, being their guardians, and representing and all of the men and women that came before us who served so proudly on this department.
Sometimes you have to protect with courage and you have to use force. Is that correct?
At times, yes. As a police officer, you will have to use force.
Sometimes serving with compassion means to understand when force is not required.
Rephrase.
What does it mean to then serve with compassion?
To serve with compassion, to me, means to understand and authentically accept that we see our neighbor as ourselves. We value one another. We see our community as necessary for our existence. And so that's what serving with compassion means to me.
Now, you've told us a little bit about your educational background. I'd like you to share with all of us a little bit more about your specific law enforcement training. You mentioned the academy. Is that where you received your law enforcement specific training?
Yes, it is.
Please describe how that training occurred.
I was a member of the first Minneapolis Police Cadet Program, and along with many other candidates, we received training, both academic training on the laws of the state of Minnesota. We received training as it relates to everything from driving and defensive tactics, community relations, and so we also, there's post requirements of Minnesota Post Officer Standards and Training to receive our license. There was a test that we had to take then. There was also scenario-based training as well to grade and assess how we performed during that training in the academy. And so that was part of that important training that I received along with my candidates at the academy.
And that was the very first Minneapolis Police Academy?
That is correct.
And a trainee at the academy is that trainee referred to as a cadet?
That is correct.
At your employment, you've been continuously employed as in the Minneapolis Police Department since, was that 1989?
That is correct, sir.
Has the academy changed since you first were a cadet back in 1989?
It has. And while I certainly believe that at the time back in 1989 that training was important, like any police department, we should not be monolithic. Our communities are not monolithic. our training should evolve. We should be focused on what our national best practices, and so the training that our recruits and cadets get today, and rightfully so, is far better than the training that I received those years ago.
Well, we'll circle back to that a little bit later. You also mentioned that you take post credits, is that right?
Yes, that is correct.
And POST stands for Peace Officer Standards and Training?
That is correct.
What is the requirement for post training? How many courses are you required to take in a given period?
Yeah, every sworn peace officer in the state of Minnesota receives their license through the POST, Peace Officer Standards and Training Board, and so POST will change up what some of those requirements are from time to time, but some of the ones that I think of right now would be crisis intervention training. There's certainly defensive tactics training. There's now a form of procedural justice training that is required, and so Minneapolis police officers receive that mandated training, but we're also very fortunate that we're able to receive additional training above and beyond what is required of the post board.
And you personally participate in this training in order to maintain your post license?
That is correct.
Chief, you began your career in 1989. You're now the chief of the police department. Fair to say you've had many roles within that department. Is that correct?
That is correct.
Now, at this time, I'd like to publish Exhibit 209, if I may. And we'll leave that up, if we may, while you testify. What was the first position you held within the department after you completed your academy training?
I was sworn in as a Minneapolis police officer.
Now, we've heard that term sworn officer before. Can you please explain to the jury what that means?
Sworn officer, after you complete the required educational requirements, and certainly after you complete your performance measures at the academy, then you are eventually sworn in at a location, and traditionally our city clerk has been there, and you take an oath, and you're sworn in as an official member of the Minneapolis Police Department, but also as a City of Minneapolis employee, and you start your employment with the city then.
And what were your duties then as a sworn police officer, that rank for the City of Minneapolis?
Primary duties was to be a 911 responder, to work in a geographical area of the city of Minneapolis in a district, at a precinct, and respond to 911 calls on a given shift.
Are those also called calls for service?
That is correct.
And as a patrol officer at that time, well, how long did you remain a patrol officer?
Approximately 5 years or so.
And can you tell the jury what geographic district you served as a patrol officer?
Yes, I served for a short time in the 3rd Precinct, and then I think the bulk of that time in the Minneapolis 4th Precinct, which is located in North Minneapolis.
During that time period, that 5 years as a patrol officer, did you ever have occasion to arrest a suspect?
Yes, I did.
How about a non-compliant suspect?
Yes.
You've had to place handcuffs on someone who was not compliant?
That is correct, yes.
Approximately, would you care to guess how many times?
I'm sure several. I'm sure several.
This is something that's a fairly regular occurrence as a police officer, as a patrol officer. Is that right?
That is correct.
You've had to be in situations where you've had to use force. Is that right?
That is correct.
Have you also been in situations where you've had to de-escalate or talk someone into compliance?
Yes.
And is that a regular part of your job as a patrol officer?
Yes, it is.
Even from 1989 to approximately 1994.
Yes.
Then after serving this period of time as a patrol officer, what was your next position at MPD?
And I believe in 1997, I was then promoted to the rank of sergeant in the Minneapolis Police Department.
And what do you have to do to be promoted to the rank of sergeant? What are the requirements?
It is a civil service test that you take, and you have to successfully pass that and receive a grade from that. And I'm trying to recall if there was an assessment center that was also part of that testing process. But there is a number of years that you have to at least have served as a police officer before you can take the sergeant's test and promotion.
And what is the role of a sergeant in the Minneapolis Police Department?
Sergeant's role, and I've often said it is the most influential role in the police department.
How so?
It's most influential because you have the most proximity to the men and women who are out there serving in the community. You're there for them at the roll calls. You are a mentor. You give them guidance. They are going to see you far often than they would ever see the chief of police, for example. And you set the tone in the attitude. And so that's really a very significant role within the Minneapolis Police Department.
That's a first-line supervisory position, correct?
Yes, it is.
And sergeants or people with that rank within MPD would serve in a variety of jobs or functions. Is that correct?
That is correct.
And how did you serve as a sergeant when you were first promoted?
I served as a investigator with the property crimes unit at that time.
How many people approximately did you supervise?
At that time, I did not supervise any. I worked as a detective or investigator alongside other detectives.
Okay. How long did you hold that position?
Approximately 2 years.
And after that?
Then I served as a sergeant in our Minneapolis Police Department Internal Affairs unit.
Describe what a sergeant in internal affairs does.
Sergeant Internal Affairs is responsible for investigating cases of misconduct involving Minneapolis Police Department employees, and fact-finding, preparing reports, and ultimately submitting those to their supervisor.
Can those investigations include inappropriate uses of force or excessive force?
Yes, they can.
And have you ever evaluated an excessive force case in internal affairs context?
I believe I have, yes.
How long did you serve as a sergeant in internal affairs?
I served in that position about 2 years as well.
And then what did you do?
Then I was promoted to the rank of lieutenant.
Now, what was required of you to promote to lieutenant?
That also required taking a civil service exam, and I believe certainly at that time an assessment, going through an assessment center, which comprised of scenarios and different type of performance measures for that position.
Is it true that a lieutenant is it's a higher level of management above the first line sergeants?
Yes, our lieutenants are considered managers within the organization.
And what were your duties then as a lieutenant?
I served for a time as overseeing at that time, the federal mediation agreement that the Minneapolis Police Department had entered into with the Unity Community Mediation Team. And I also served time as a 4th Precinct lieutenant on the night shift.
Okay. And what is lieutenant in the 4th Precinct night shift? What do you do?
You have a team of sergeants and a team of officers on a shift. That particular shift worked the night hours in North Minneapolis, and really there as a lieutenant there to support the mission of the precinct inspector, who is kind of like the chief of that precinct, but also then to support your officers on the shift as well. Yes.
And how long did you hold that position?
That was probably about 2 years as well.
Seeing a pattern here. What happened after that?
After that, I was appointed to the rank of commander.
And what does a commander do?
Commander now, unlike the previous civil service positions, a commander now is appointed specifically by the chief of police, and it is a higher position, and the commander is usually in charge of a division. And so at that time, I was appointed to commander of the Internal Affairs Division.
And so you're now back to internal affairs, but more or less overseeing the entire operation?
That is correct.
And how long did you hold that position?
About 2 years.
Okay. And after that?
Then I was appointed as the first precinct inspector, and so that was a position in charge of the downtown precinct or first precinct, and that was a patrol function, so that was mainly patrol-related functions, even though we do have great civilian teams who work on things such as crime prevention and others, but I was appointed to first precinct inspector.
And what does the inspector do at that level?
The inspector at that level is really driving the work of the precinct, monitoring and working on trying to reduce crime in that precinct, working with its stakeholders, its neighborhood associations, its business community, making sure that whether it's investigative or patrol in the precinct, that they have the resources and things that they need, interfacing with the city council members of that particular ward. And so that is really a lot of the work that a precinct inspector does.
And does the precinct inspector then supervise, maybe not at the ground level, but is responsible for the supervision of all of the different positions underneath the inspector?
That is correct.
And how long were you in that position?
About 2 years.
Okay. And after that?
Then I was appointed to be deputy chief of staff.
And what does a deputy chief do?
Deputy chief at that time was a unique role in that I was really chief of staff for the chief of police, a lot of work helping to support our department initiatives, reaching out to elected officials, community stakeholders, boosting up programs, grants that the department had received, and really carrying out the mission of the chief of police.
And from there?
After about 2 years, I was appointed to assistant chief of the Minneapolis Police Department.
And by whom were you appointed?
Then it was former Chief Janae Harteau.
And what did you do as the assistant chief?
That was really overseeing the day-to-day operations of the Minneapolis Police Department, and again, also supporting the chief.
And for approximately how long?
That may have been a little shorter, about a year or so, I think.
You've broken the pattern.
Yes.
And now, of course, you're the chief of police. How were you selected, or who selected you to be the chief of police?
Well, I served in an acting or an interim capacity then under Mayor Betsy Hodges, and then after that term ended, then Mayor Fry of the city of Minneapolis appointed me as chief of police.
You may take that exhibit down. So you've had certainly, it seems, every rank available within the Minneapolis Police Department and a variety of roles. Is that right?
That is correct.
And as such, are you familiar generally with the day-to-day operations, I guess from the patrol level all the way up to the level you are now?
That is correct.
What I'd like you to do at this time is provide us with a little bit more information, sort of an overview of the Minneapolis Police Department and how it serves the city of Minneapolis. MPD's jurisdiction is within the geographic limits of Minneapolis, is that right?
Yes.
And what's the approximate geographic area that you have jurisdiction over?
Well, to the north, we border Brooklyn Park, Brooklyn Center. To the south of Richfield. To our east, just right up against the River St. Paul. And to the west, Golden Valley. And so it's a pretty large area.
Would you agree that's about 58 square miles, give or take?
Yes.
And are you aware of the current population of Minneapolis?
Roughly about 30,000.
How many sworn officers work for the Minneapolis Police Department?
Currently, around 700.
And as the chief, are you generally familiar with the officers who work for you? It's a lot of people.
It's a lot of people, and so it can be taxing to try to. We've got a lot of people that work in different areas, but I have a pretty good understanding of where folks are throughout the organization. Yes.
As we go on, I'll be asking you if you recognize some of the names of different people we may have met to this point, but at this time, up until May 26, 2020, an individual named Derek Chauvin was a Minneapolis police officer. Is that right?
That is correct.
And are you aware of who this person is?
I am.
Do you recognize this person in the courtroom today?
I do.
Would you please point to him and describe what he's wearing?
Yes. Mr. Chauvin's right there. He appears to be wearing a navy blue suit with a light blue tie and white shirt.
Thank you, Your Honor. May the record reflect that the witness has identified the defendant. So I'd like you to please describe for the jury how MPD is structured to deploy law enforcement services to about 420,000 people over a 58 square mile area, 24 hours a day, every day. Administratively, how is the department organized?
Administratively, we are broken down into bureaus. And so, as I may have mentioned, you have the chief of police that really leads the organization and its mission and vision and goals. And then we have an assistant chief that oversees the day-to-day operations. After that, there are 3 deputy chiefs. And we have a deputy chief of patrol. The deputy chief of patrol is responsible for the 5 geographical precincts throughout the city of Minneapolis. We also have a deputy chief of professional standards. And that deputy chief oversees really 2 main functions, and that is our training for our entire department, as well as the internal affairs portion of our department. And then we have a deputy chief, the 3rd one, of investigations. So all of the employees who work, whether it's homicide unit, robbery, assault, that deputy chief oversees the investigations bureau. And we also have commanders who oversee these divisions. As I mentioned, they're above the civil service rank. They're appointed, and they serve in different divisions. And the precincts, as I mentioned, there's 5 geographical areas. We have 5 precinct inspectors, and they are like the chiefs of police for those precincts. Yes.
And so by my count, there were 3 bureaus. You have investigations, patrol, and professional standards. Is that right?
That is correct.
And the investigations bureau has a number of individual units within the bureau, correct?
That is correct.
For example, what type of units are within investigations?
Yeah, investigations bureau has homicide, assault, robbery, crimes against children. There are several different investigative units.
So within the investigative bureau, you mentioned homicide. That's where Lieutenant Zimmerman would work. Is that right?
That is correct.
Okay. And the patrol bureau, that provides services such as 911 response, like you did when you were a patrol officer. Is that right?
That's correct.
Crime prevention, traffic control, emergency services, all within the patrol bureau?
Yes.
And in individuals, sorry. And within the Patrol Bureau, in order to provide those patrol services over the geographic area, we've heard about precincts. Is that right?
Yes.
And if we could publish Exhibit 269. Looking at Exhibits 269, is this the geographic area of your jurisdiction?
Yes, it is.
And then can you just use 269 to describe the precincts and what they are and what purpose they serve?
Yes, this exhibit outlines the 5 geographical precincts, and this also lets our community know which precinct, based on where they happen to live, which precinct their residence or business is a part of. And so you're able to see from this map here, Sector 1 or Precinct 1 kind of is in the center there, covers downtown, Cedar Riverside area. The number 4 at the top left-hand corner would be our North Minneapolis precinct. And then second precinct, number 2, covers southeast, northeast Minneapolis. And then 5th precinct covers southwest Minneapolis near the lakes area. And then the 3rd precinct covers our southeast Minneapolis area.
And focusing specifically on the 3rd precinct, I see it's divided further into these sectors. Is that right?
That is correct.
And that's for the purposes of being able to deploy patrol services, correct?
Yes.
Within the various precincts, this is primarily a tool for dispersing patrol officers, correct?
Yes.
But there are also investigative functions within the precincts as well, correct?
Yes.
That would be specifically assigned to that precinct?
Yes.
But professional standards, that would cover all of the precincts. Is that right?
Yes.
Okay. If we could publish 268, I'd like to focus specifically on the 3rd precinct. Well, it's a little hard to see, but you can see the. That's much better. Thank you. You can see the different colors. It appears the sectors that we looked at in the previous exhibit are listed here. And if you take a look at Sector 1, that would be represented as 310 on the Exhibit 268. Is that right?
Yes.
And then Sector 2 would be Exhibit 320?
Yes.
All right. And we won't go through each of the sectors, but the purpose of these sectors, again, is to further distinguish different geographic areas within the 3rd precinct or any precinct, so we'd be able to have, say, dispatchers deploy law enforcement resources there. Is that right?
That is correct.
Dispatchers like Jenna Scurry, for example, could send a car to a particular location based on the different sectors that are within this precinct map. Is that right?
That is correct, yes.
And a Professional Standards Bureau, you can take that down, please. The Professional Standards Bureau, what does a Professional Standards Bureau do?
One of the functions is training. We have a commander, again, that is one of the appointed ranks, who oversees the training division, and they're responsible for making sure that not only are our officers in compliance with our mandated post-board educational requirements every year, but also really looking to make sure that we continue to evolve and that we're staying on top of necessary training that's important for us, that has a benefit to our communities that we serve. And so that's a core piece to what our professional standards training division does.
And so within professional standards, you have the training services, and that's staffed at it's at the commander level, led at the commander level.
That is correct.
And who is the current commander of the training division?
The current commander for the Minneapolis Training Division is Commander Darcy Horn.
Last year, who was your commander?
Last year, she's now Inspector Katie Blackwell, but she was Commander Katie Blackwell last year when she led our training.
And she would have been the training commander on May 25, 2020. Is that right?
That is correct.
Okay. There's other divisions within professional standards. I think you mentioned internal affairs, but there's also an administrative services division. Is that right?
Yes.
What does the administrative services division do?
Administrative Services Division can deal with everything from grants, different types of programs that the City of Minneapolis is embarking upon, employee personnel matters as well.
Also, business software and equipment,
Technology, business software, yes.
body cameras, milestone cameras.
Yes.
And we met Jeff Rugel, and that's where he works. Is that right?
Yes, Lieutenant Rugel is part of that. Yes.
I'd like to talk to you a little bit about the Minneapolis Police Department and reacting to calls for service. The role of the Minneapolis Police Department is generally to serve the community's law enforcement needs. Is that right?
That's correct.
And most requests for service come in through the 911 system. Is that right?
Yes.
You respond, or officers respond to different calls for service. Could you please describe the types of calls for service Minneapolis Police Department commonly responds to?
Calls for service can absolutely range from everything from tenant trouble to a loud party dispute to domestic assault to shooting and to even homicide. So it can really range from a wide variety of types of calls.
People will call to report a crime and request assistance. Is that
Yes.
right? People also call to report, general emergencies.
Yes, they can.
What type of emergencies?
Medical emergencies. They can request calls for service for that. Oftentimes we have community who are calling because it may be 3 o'clock in the morning and they don't know of any other service or who will respond, but they will call us for those types of situations as well.
And I suppose what constitutes an emergency is in the eye of the caller somewhat?
That's correct, yes.
But nonetheless, MPD responds.
Yes.
Do you know approximately how many calls for service the Minneapolis Police Department receives annually?
It's usually a couple of 100,000, and then we also have officers that we categorize as self-initiated activity. So that could mean an officer happens to be driving through a neighborhood and sees something and reports out on their radio that they're going to look into it. So it's a combination, but it's a lot of calls.
And generally, people don't call the police department to say, hey, everything's going great. Just wanted you to know they have something that they want you to do.
Exactly, yes.
It sounds then like it's fair to say there's more to policing than just going out and arresting people. You provide a broad spectrum of policing services to the community.
Yeah, I would actually say that the actual law enforcement part is probably pretty small compared to most of the types of calls our officers are being called to address and deal with. Yeah.
So we've touched on police training, your own personal police training, and how police training is dispensed, I guess, through the Professional Standards Bureau. I'd like you to describe that a little bit further. Are you generally familiar with the types of training that the Minneapolis Police Department provides its officers?
Yes, I am.
Where does this training take place?
We have a large facility located in North Minneapolis, which we call our Special Operations Center, and that is where the vast majority of our required training takes place.
Is the Special Operations Center then a dedicated building only for training purposes?
It's primarily dedicated for training purposes, yes.
And I think you testified it's supervised by a commander. I'd like you to tell the jury a little bit about when now currently training begins for a Minneapolis police officer who's hired on to the department.
For a new officer who's hired onto the department, that first initial orientation to our training begins at the academy. And that, again, is overseen by the commander of the training unit. And we actually have a class currently in place now at the academy at the SOC. And so that first initial indoctrination to our academy occurs during that first part of the training at the academy.
Fair to say that the training that's provided to Minneapolis police officers can be generally divided into two categories: pre-service training and post-service training. Is that right?
Yes.
And the pre-service training would include the academy that you just talked about. Is that right?
That is correct.
And then post-service training is the continuing education that you testified about previously. Is that right?
Yes.
So let's again focus on the academy training. How many cadets do you generally have at a given time per class?
Well, it's usually been a mixture of recruit classes and a cadet class. I would say that we average in terms of recruit class numbers around 30. Cadets might be 20 to 25.
So now I'm going to ask you to just define some terms a little and explain to the jury the difference between a recruit and a cadet.
Recruits are typically individuals who've already been laser focused on a career. Being a Minneapolis police officer is what I wanted to do. They typically have already at least their 2-year criminal justice or law enforcement degree. Most have completed their required skills training. Cadet was really created to capture diversity of candidates. And so the cadet might have individuals who may have had a psychology degree, but it's really streamlining them in. It's a little lengthier process, but it's really getting them on board so that they meet the state requirements, the post requirements to get to be hired. And so the cadet program is a wonderful way for us to capture diversity within our police department. And so, but they both, once their programs are finished, they're both classes, whether you're a recruit or cadet, you are ready to successfully become a Minneapolis police officer.
Do you also take lateral candidates?
Yes, lateral candidates. We certainly have had hirings of laterals in the years past, yes.
And do those individuals also go through a similar training as a recruit?
Yes, the laterals can. It's usually much smaller in length of time just because laterals are individuals who've already served as police officers, perhaps in another jurisdiction or another part of the state, or out of state, actually.
We'll get a more detailed description from another witness, but just at a very high level, can you describe what the trainees do at the academy during this pre-service training?
Trainees at the academy during pre-service, it's their first indoctrination into this world of being a police officer. So they're being taught about city and statutory laws. They're being trained on procedural justice and critical thinking, defensive tactics. They're having community members come in and speak to them about different aspects, whether it relates to things in our cultures within our city. Technology is a huge piece to that. Learning how to write reports on our computers. They're really getting that basic indoctrination into the Minneapolis Police Department.
As far as the methodology, is it typically classroom delivery? Do you also have practical application? How does that work?
Yeah, it's a layered approach. It's both the practical academic studying, examinations that occur, but it's also scenario based. And so there's scenarios that they will go through, and whether that's crisis intervention training or other aspects. So it's a layered approach to the training.
And in this pre-service training, then, once the officer or candidate has completed the pre-service training, what's the next phase before becoming a fully functioning police officer?
Once they complete that training, they're making sure, obviously, that they've met the requirement for the licensure for the Minnesota Post Board, and then ultimately they're going to get sworn in and hired on as Minneapolis police officers.
Are you familiar with a program called the Field Training Program, or FTO?
Yes, I am.
Is that part of the pre-service training?
That would be, yes.
Can you just give us a general description of what the FTO or Field Training Program is?
The Minneapolis Field Training Officer Program is really, once the recruit has gone through that series of pre-service training, it's now teaming them up with a mentor, basically. And they're being gauged and judged on certain performance measures. And it takes course over a period of several months, usually about 5 months. And they're given instruction. They're seeing how well they are able to handle certain types of situations, calls. And they're also having feedback, not only from their FTO, but they're also having conversations with the supervisors in the training bureau and seeing how they're doing. They're assessing their progression. In the event a candidate is not progressing, they're making sure that there's support mechanisms for that, where do they need extra help. And yes, at times, we have candidates that don't successfully complete it. And so, but that's really getting them to the point where they can ultimately be really on their own and be able to function on their own as a sworn Minneapolis police officer.
Okay. And so once they've completed the field training program, and I think as per your testimony thus far, the training doesn't stop there. You have post requirements that you have to fulfill every year in your post-service training. Is that right?
That is correct.
And is that delivered through a series of in-service trainings that occur at the same training facility you mentioned?
Yes.
Is that training optional? Can an officer go somewhere else to get their post credits and skip the in-service, or is that training required?
That training is required annually.
Do you have to take it?
Yes, I do.
What type of training is provided in the post-service training?
Some of the training that is provided in the annual training can be critical incident training, CIT training.
CIT is crisis intervention training?
Crisis intervention training, thank you. Yes, crisis intervention training, defensive tactics, basic CPR or first aid. Those are some of the types of training that is required annually. Yeah.
Even though they've already ostensibly been trained on all of these things before, you're still doing the same training annually?
That is correct.
Why is that?
A lot of that is just to reemphasize the importance of the training itself, muscle memory, because all of our department members are being taught the same thing. We may have officers that are working in a patrol capacity 1 year, and the next year they may be in investigations, but they may be called to assist upon. And so it's making sure that all of us have that basic necessary core fundamental training to better help serve our communities.
So if you could give the jury kind of an idea of the amount of time that is spent training your officers.
It's a lot. We put a lot of time, energy, and resources into our training. I believe last year, the Minneapolis Police Department, in terms of our mandatory in-service training and leadership training, we probably spent about $8.5 million. In our pre-service and in-service training, that was probably about $4.5 million. So training is absolutely vitally essential to us as a department.
And officers are paid while they're being trained, is that correct?
Yes, they are.
And would it be fair to say that part of the objective of training is to impart Minneapolis Police Departmental policies onto the officers so that they know what those policies are and are able to apply them?
Yes, it's important through training that we're reemphasizing not only our policies but really our values as a police department and what our community expects of us. It's to help our officers, and it's also to help our communities at the same time.
As a former patrol officer who's used force, put handcuffs on people, I mean, you understand the reality of what policing is like when you're actually on duty. Is that right?
That is correct.
You also testified that you've participated and continue to participate in the training that's been provided by MPD and has continued to be provided. Is that
yes,
right?
That is correct.
Is this training practical and useful?
Yes, it is.
Why do you say that?
Our officers are being called, particularly patrol officers, are being called to, again, respond in a way to our community's needs. And it's hundreds of thousands of calls that they respond to. And, we are a very interesting profession in that to some professions, your body of work matters. And to an extent, within the Minneapolis Police Department, our body of work matters, but it's more internally. But to our communities, for the most part, your body of work doesn't hold as much value. We don't have the luxury of being able to go up to a community member for the first time and say, those 99 calls I was on before went really well. Trust me on this one. We don't have the luxury of doing that. Our communities are going, no, what have you done for me lately? This interaction, I'm going to grade you on how you treat me during this call, during this interaction. And so we have to make each engagement with our community count. And so the training is very important because for many in our communities, the first time that they encounter a Minneapolis police officer may be the only time in their life they do. And so that singular incident matters.
Aside from the usefulness of it to the community, what about the usefulness of it from a practical standpoint to the patrol officer out on the street? Is this training practical, or is it more aspirational?
No, it's very practical. And as I had mentioned earlier, it's so important that we evolve as a police department and meet our communities where they are. And I'll give a couple examples if you don't mind. We've talked a lot about within the department that we know that our communities suffer at times and go through trauma. So it's very important for our men and women to have training as it relates to how we respond in those moments. What resources can we provide for community? But one of the things that we have not talked about in this profession, and sadly, is the impacts of trauma on our own officers. And so wellness, we do a great deal of training and work on officer wellness because we need to make sure that our officers are well when they're interacting with our communities in that regard. I will also tell you a few years ago, we were hearing from members of our transgender community and how they had felt police have played a role in their lives, and not always good, quite frankly. And so we were able to, through conversation, through discussion, through meetings, being very authentic, we were able to sit and craft a policy based upon members of our transgender, gender nonconforming community really guiding that. And we had the first policy ever in that. And so, again, it's so important that we as a police agency continue to evolve, continue to place value on all of our community members. And so that's very important.
Now, speaking of Minneapolis police policies, you're aware that the police department has a fairly extensive policy and procedure manual. It's pretty thick, correct?
Yes.
And is it important then for policies and procedures to be in a written form so that officers can understand what the expectations are?
Yes, it is.
And those are public documents so that the public, they're also able to see what the expectations of the police officers are, correct?
That is correct.
As the chief of police and being employed by MPD as long as you have, I take it you're familiar with the Minneapolis Police Department policy and procedure manuals and all the content contained inside?
Yes.
You, in fact, created some of these policies?
That is correct.
Are Minneapolis police officers required to be familiar with the various written policies?
Yes, we are.
And there's a policy requiring them to be familiar with the policies, correct?
Yes, that is correct.
Right. So if you would please publish Exhibit 207. If you would highlight Section 1-103. This is the policy about the policy, and it requires that the MPD employees shall be provided instructions on how to access the policy and procedure manual. Is that right?
That is correct.
and they're accountable for knowing how and where to access, and for knowing the contents of the manual. Is that right?
That is correct.
And they're also required to sign a receipt acknowledging their responsibility for knowing the contents of the manual, correct?
Yes.
Because the first policy manual that you would receive as a patrol officer might not be 30 years later what you're going to be looking at, correct?
Yes.
The policies are changing, but they're published, they're public, and officers are required to know what they are and to sign something saying that they will continue to review them. Is that right?
It's preliminary, overruled.
Yes.
All right. Well, if you could take that one down, please. At this time, asked to just display to the witness Exhibit 274 for identification. Sir, do you recognize this is a general form here of being an electronic version of the MPD policy and procedure manual acknowledgement?
Yes, I do.
This is an example of an acknowledgement form that a Minneapolis Police Department employee, patrol officer would sign upon being hired. Is that right?
Yes.
Just indicating that they're aware that there are written policies and committing to reviewing them and accessing them. Is that right?
Yes.
At this time, I'm going to offer Exhibit 274.
$274 is received.
All right, if we could then publish Exhibit 274 to the jury. And you see this is, again, one of the forms that was signed by a particular officer upon hire. And if you could please highlight the name. And that's signed by Derek Chauvin, Derek Chauvin, badge 1087, December 28, 2001. Is that correct?
Yes.
If you could take that down, please. Minneapolis Police Department has a code of ethics, is that right?
Yes.
And the code of ethics is contained within the policy manual. Forgive me, we're going to be talking a lot about the policy manual and kind of march through some of these, but the code of ethics, if you could please display Exhibit 215, page 2, and if you could highlight 5-10201. And as the Code of Ethics provides in the policy manual, law enforcement officers' fundamental duty to serve mankind and safeguard lives and property, and to protect the innocent against deception and the weak against oppression and intimidation. Is that right?
That is correct.
And if you could take that down, Minneapolis Police Department also has a professional policing policy. Is that right?
Yes.
At a high level, can you describe what professional policing means in this context?
Yes, our Minneapolis Police Department, professional policing, it's really about treating people with dignity and respect, above all else, at the highest level. It's that we see each other as necessary, we value one another, and it's really treating people with the dignity and respect they deserve.
If we could display then Exhibit 215. And drawing your attention to page 4, section 5-104.01. Sir, is this the professional policing policy?
Yes, it is.
And could you read the first bullet, please?
The first bullet reads, "Be courteous, respectful, polite, and professional."
And if you would then also read the third bullet.
Ensure that the length of any detention is no longer than necessary to take appropriate action for the known or suspected offense.
And you can take that down, please. Sir, fair to say that law enforcement generally has changed a lot since you started back in 1989, is that right?
That is correct.
1989, you didn't have body-worn cameras, correct?
That is correct.
And nor did you have sort of the ability for civilians, bystanders, to video or record conduct of police officers, right?
We did not.
Because we didn't have smartphones.
That's true.
And now we do.
Yes.
And as you indicated, the policies and culture of the police department has to change with the times. Is that right?
Yes.
And so in terms of understanding that sometimes bystanders do use their smartphones to take video images of police officers, has the Minneapolis Police Department imparted any training or constructed any policies to prepare officers for people recording them?
Yes, we have. We've imparted policy that really is informing officers that individuals under their First Amendment rights, they have the absolute First Amendment right to record through cell phone video or other types of video officers interacting or engaging with a community member, with the exception that they cannot obstruct the activity of the officers, but they absolutely have the right, barring that, to record us performing our duties.
And what does obstruct mean in this context?
Obstruct would mean interfering, doing something where you are physically placing yourself in a position where you're prohibiting the officers for carrying out their lawful duties. But barring that, individuals have the right to record our engagement with our community.
Well, Chief, you'd have to acknowledge that a patrol officer may find it irritating to have a civilian recording their activities. True?
Very true.
Is that obstruction?
It is not.
At this time, I'd like to display to the witness only Exhibit 273. And if I may step away for a moment. And at this time, I will offer Exhibit 273.
Any objection?
No objection.
273 is received.
If you would publish 273, and I'd like to draw your attention to Section 9-202. And again, this is the public recording of police activities, providing employees guidance with dealing with members of the public, recording them. Is that right?
Yes, it is.
And generally, this informs officers that unless you're being obstructed, people get to record you,
Yes,
even if you don't like it.
that is correct.
And how long has this been policy of MPD?
Since May of 2016.
Thank you. You can take that down. Sir, are you familiar with the concept of de-escalation?
Yes.
What is de-escalation?
De-escalation is providing a knowledge base or skills, in this case for officers, to really focus on time, options, and resources. It's really primarily trying to provide an opportunity to stabilize a situation, to de-escalate it, and with the goal is having a safe and peaceful outcome. And so there's tools associated with that, but that's really the goal of de-escalation: time, options, and resources, so that we can stabilize a situation peacefully and safely.
When you think of de-escalation, are you thinking of it as the sort of the opposite of using force, or is it a part of using force?
We teach it as both.
And when you started with the department back in 1989, was there an emphasis on de-escalation?
It was not mentioned. It's not heard of back then.
Okay. When did de-escalation start becoming more of a topic of conversation in law enforcement communities?
I think that right around late 90s, 2000, I think that when we were, when there was attention, not only in Minneapolis, but in departments across the country, and incidents particularly involving police encounters with those who were suffering from mental illness, we really started to see a lot of work on that. Here locally, the Barbara Schneider Foundation, there was a very tragic incident in Minneapolis many years ago that involved the death of a community member. But when we started, that was really what kind of culminated for our department, de-escalation. And even when you heard departments starting to talk about other tools like tasers, all of these types of things, it was around that time frame that I think our department really started getting a lot more education, awareness, and training as it relates to de-escalation.
What about just, even if you weren't taught de-escalation formally when you started back in 1989, as a practical matter in practice, is that something that's been employed by experienced police officers for a long time now?
Yes, it has.
What about in your own experience when you were on patrol? Did you use de-escalation techniques?
Yes, quite a bit. Yes.
And did you find them to be effective, a way to maybe talk somebody down from a situation rather than needing to use force?
Yes, and with the primary goal is that you want to keep yourself safe as an officer, and you also want to keep the community safe. And so a lot of it hinged on communication and listening and verbal skills. And so if you could talk your way out of a situation to de-escalate where it didn't have to result in physical force, those were things you certainly utilized, and you were always in a better position to look upon someone that you worked with who had that skill set to do that.
But if you can't talk somebody out of the situation, if you can't de-escalate, you can't, right? And you have to then use a different method.
That is true.
Okay. And so it really comes to what's reasonable at the time. Is that right?
Yes.
Does Minneapolis Police Department currently have a de-escalation policy?
We do.
And at this time, if I can display Exhibit 219. You have this one, okay. I think it is admitted. I just want to make sure you have it. Okay. Yes, if we could publish Exhibit 219. And then Minneapolis Police Department Policy 5-304, threatening the use of force and de-escalation. This is the policy, and it's a policy as it existed on May 25, 2020. Is that right?
That is correct.
If we could highlight the first paragraph A, threatening the use of force. Okay. And I'd like you, sir, to please just read into the record the paragraph that you see here. All the way up until, the first sentence. We'll make you read the whole thing.
As an alternative and/or the precursor to the actual use of force, MPD officers shall consider verbally announcing their intent to use force, including displaying an authorized weapon as a threat of force when reasonable under the circumstances.
And I guess, is it an either-or alternative? Is it like you either de-escalate or use force, and once you start using force, you just give up on de-escalation?
The goal is to resolve the situation as safely as possible. So you want to always have de-escalation layered into those actions of using force.
And if you could take that down and highlight paragraph B, de-escalation. In accordance with the policy, officers, the language here is mandatory when reasonable, whenever reasonable, shall use de-escalation tactics to gain voluntary compliance. Is that right?
Yes.
And to seek to avoid or to minimize the use of physical force, correct?
Yes.
And seeking to minimize physical force, that can be happening while physical force is being employed, can't it?
Yes.
An officer can be using physical force and during the course of that still maintain attempts to de-escalate and defuse the situation.
Yes.
Okay. And if you could clear that, please. And as part of a de-escalation, the policy indicates the officers are supposed to do what?
Attempt to slow down or stabilize the situation so that more time, options, and resources are available.
When you talk about more time, options, and resources, could options and resources include, for example, using other officers who may be at the scene?
Yes.
Or calling for backup?
Yes. Actually, it can also include seeking community's help in a situation as well.
And in employing de-escalation techniques, in accordance with the policy, the officer is required to consider a number of factors regarding the subject. Is that right?
Yes.
And we're assuming here that the subject is non-compliant. You run into people who, maybe don't want to comply with police officers, but you can also run into people who just, for some reason, are unable to do so at that moment. Is that right?
Yes.
And officers are required to consider, if you could highlight B and the bullets that come underneath. The officers under the Minneapolis de-escalation policy are required to consider whether the subject's lack of compliance is a deliberate attempt to resist or an inability. Is that right?
Yes.
And if you could read, first, the first bullet is medical conditions, correct?
Yes.
We have mental impairment, developmental disability, physical limitation. Some of you may just be physically unable to comply, correct?
Yes.
Language barrier. The city of Minneapolis has a variety of people who speak a variety of different languages. Someone just may not understand you, right?
That is correct.
And if you're not considering that, perhaps the situation could escalate into something greater than it would need to be.
Yes.
The last two bullets, first, could you read the second to the last bullet?
Yes. One of the other considerations officers should take into account is the influence of drug or alcohol use.
How so?
We know the research says that people can react differently when they're under the use of alcohol or drugs. And so you trying to give verbal commands, if someone's under the use of alcohol or drugs or you're doing force, it may have a different reaction to them. So that should be something that you should be considering.
And 12:30. Sir, drug or alcohol use, in this context is being required that the officer consider to determine if de-escalation is appropriate. It can be true that some people who are under the influence of drugs or alcohol can become dangerous, correct?
That is correct.
But isn't it also true that some people react completely different and they are not necessarily dangerous if they're under the influence of alcohol or drugs?
That is correct.
In fact, they may not be more dangerous, they may actually be more vulnerable.
True.
And it's important that the officer considers that when determining whether to go the route of force or continued force or de-escalation. Fair?
Yes.
Behavioral crisis is the last bullet I'd like you to discuss. What do you mean by behavioral crisis?
Behavioral crisis, of all the bullets, sometimes that is probably the one that our men and women experience in our communities most. If someone loses a job, that can trigger a behavioral crisis. If someone loses a loved one, that can trigger a behavioral crisis. If someone has themselves got the worst diagnosis from their doctor that day, that can trigger a behavioral crisis. And so we want our folks to take all of those things into consideration. When I talk about meeting our community where they are, that's probably the one that we need to really focus on. Yeah.
And as you testified earlier, the police just don't get to meet people on their very best day, do they?
No, they don't.
And the behavioral crisis, as the kind you've described here, can in fact be a barrier to compliance. Would cause an inability to comply, even if not, an intentional inability to comply. That's fair.
Let's go to list lead,
Yeah.
please.
Yeah.
Thank you.
And so the purpose of the listing a behavioral crisis as a point of consideration for a law enforcement officer is what?
Again, it's recognizing that when we get the call from our communities, it may not often be their best day, and they may be experiencing something that is very traumatic. But we're going to respond, but we have to take that into consideration because, as I mentioned again, we may be the first and last time they have an interaction with a Minneapolis police officer, and so we have to make it count. It matters.
Would this be a good time to stop before I go to the next line? I'm sorry, I was trying to push it to the time limit. So.
Just whatever's a good break.
All right, members of the jury will take our lunch break, come back at 1:30. Chief, you may step down.